Welcome back to our virtual Healthier You conference. I hope you found the information that we presented so far to be useful. Our next presenter will be discussing seasonal affective disorder and light therapy. His name is Wayne Brown. Wayne was born in Los Angeles, California, and raised here in the Bear Lake Valley. His father was a photographer and a mail carrier, and his mother was a teacher for over 20 years. Wayne graduated from Utah State University with a bachelor's degree in social work and a minor in sociology. While he was at Utah State, Wayne worked as a REACH peer for the Counseling and Psychological Services Office. Wayne also served on the Student Advisory Council, and he was an active member of the National Association of Social Workers at Utah State. Wayne graduated with his master's degree in social work from Boise State University. Wayne completed internships at both McKay-Dee Hospital in Ogden, Utah, and at Bear Lake Memorial Hospital. And Wayne began his career with Bear Lake Memorial Hospital Counseling Services in February of 2015. Wayne has worked as the executive director of the Bear Lake Anti-Drug Coalition, Enough is Enough. He did that from 2014 to 2018, and he was also part of the Victims Assistance Unit. He's helped many victims of domestic abuse. Wayne is proud to be a Bear Laker, and he loves being able to do his part to improve and enhance the community, especially through his work and volunteer efforts. So from Wayne, we're going to learn more about what we can do to combat seasonal affective disorder. And as a final reminder, please join us live tomorrow night at 7 p.m. where we'll have our QPR training. Thank you.
So don't just assume that seasonal affective disorder is the winter blues or a seasonal funk. This is something that actually is treatable and isn't something that you just have to tough it out on your own. We want to be able to do things that will help you effectively be able to stay motivated and engaged and doing better during those winter months. Now, seasonal affective disorder is something that, oddly enough, usually occurs in fall to winter, but can also occur for people in spring and summer, just not as often. With symptomology for seasonal affective disorder are things like feeling depressed most days, most all of the day, or a loss of interest, low energy. Things like that are very telltale signs. Sleep problems, appetite changes, weight gain. Feeling sluggish or agitated also can be a real sign of something like seasonal affective disorder. Most of the depressive symptoms, poor concentration, feelings of hopelessness, worthlessness, feeling guilty all the time. Most worrisome are things like thoughts of feelings of death or suicide. Those are real signs of there's an indication that there can be some major depressive symptoms, and these might be being caused by seasonal affective disorder. If you're finding that you're oversleeping, craving carbs, have a lot of weight gain and low energy, those are major symptoms within the fall-winter seasonal affective disorder. Your biological clock is easily thrown off and can get out of whack during seasons where we have really long nights, really short days. And then when we shift, since we're very far from the equator and we have really long days and shorter nighttime, that throws things off in the body also biologically, like serotonin production and production of melatonin, which is the sleep hormone. So we want to look for those things as what are causing things like seasonal affective disorder. There are things that can complicate seasonal affective disorder, such as social withdrawal, problems with school. If you're struggling and you're having to be up a lot because you're studying or having issues at school, people that work swing shift or complications at work or odd schedules, those things can really complicate things like seasonal affective disorder. Substance abuse is another thing that can be very complicating when we're dealing with things like seasonal affective disorder. There can be other psychological issues, eating disorders, anxiety disorders. Those kind of things can be major complications when we're talking about seasonal affective disorder. And then, of course, once again, the idea that if there's a lot of suicidal thoughts or suicidal behaviors, we need to be aware of that, because that can really complicate the way that seasonal affective disorder would present. Being able to have a physical exam on a regular basis, or being able to be willing to go in and talk to our doctor or primary care physician, whoever that would be, provider, whoever that would be, is very important when we're understanding how we might find out if we've got seasonal affective disorder, or if that's what's going on for us. There can be lab tests that can be done. That idea that we know that if the serotonin levels or melatonin levels or other certain things are off in the body, that can be caused by seasonal affective disorder. And then a psychological evaluation or meeting with a counselor or a therapist can be very helpful in understanding if what we have going on for us is major depressive disorder or some other mental disorder or just seasonal affective disorder. For seasonal affective disorder, the go-to therapy or treatment for that is what they call light therapy, sometimes referred to as bright light therapy or phototherapy. Now, research on it is limited, but by everything that we have seen so far, it appears to be a very effective treatment. There are other things, medications, especially things like extended release antidepressants may be effective. Also, other antidepressants can be very effective, so a conversation with your primary care provider is always helpful. With the antidepressants, sometimes it can take several weeks. Same thing with the light therapy to really gain the benefits of those. Now, there are things you can do for seasonal affective disorder simply with your lifestyle. You can engage and make your environment brighter, more colorful. You can get outside more often. It's hard when it's cold, but on the days that are bright, it's a nice thing to do is to get outside. Get outside and exercise. Socialize with other people. Those things can be very effective in helping to minimize symptoms of seasonal affective disorder. So, why would we want to understand and use different treatments for seasonal affective disorder like light therapy or phototherapy? Well, you may want to be able to make the effectiveness of an antidepressant more effective. And so maybe adding something like light therapy will be useful. Also, maybe you want a treatment with no medications involved that has very few side effects. Maybe you're pregnant or breastfeeding and you need to avoid medications. And also maybe you want to just maybe be on a lower dose of some kind of an antidepressant. Light therapy, adding light therapy to treatment of seasonal affective disorder could be very helpful in this. So common light boxes or light therapy lamps, similar to this one here, can be easily found online, usually in the $30 to $40 range. What you want to look for is something that says that it's a full spectrum light and that it filters out UV light. This is where sometimes people get the wrong idea that tanning beds, which are often said to be a solution for seasonal affective disorder, would work. Unfortunately, this is not true. Tanning beds put out UV light, which needs to be shielded from the eye and also can cause irritation or problems with the skin. A full spectrum light therapy lamp such as this needs to be placed about 16 to 20 inches away. It needs to be an indirect light, not just on your skin, but the light needs to be able to go in through the eye. So if you put the lamp up in a place such as this, where you can just be working and the lamp is just indirectly feeding to the eye that light. There are some tricks with light therapy. You want to be consistent with it. Most people find it most effective to do it first thing in the morning, and you want to do it for about 30 minutes every day to get the best benefit out of the light therapy. There are some risks with light therapy. You want to be able to be mindful and be aware of things like eye strain, headache, nausea, irritability or agitation that comes when starting to use light therapy. If you have any questions or anything that you would like to let us know, please use the comments and let us know those questions. We'll get them answered for you.